Hello, everyone. This is Bonnie McClafferty. And as you join our webinar, I'm the host. We're going to give everyone a few minutes to log on, just a couple minutes. We have over 150 people joining this webinar today. So I will give it a couple minutes. And while we're doing so, I will pull up my first presentation, my first slide. Thanks. Okay. Hoping everyone can see me. My colleagues, if you can give me see the slide, if you can give me a thumbs up, that would be great. Great. Thank you, Nora. Thank you, Rishi. There's Catherine. Okay, we're seeing my slide. So I'm just going to give 1 minute or so for a few more people to join. So please bear with us. Okay, I think we should start. Welcome, everyone. Good morning, good afternoon, and good evening to our audiences around the world. For those who haven't met me before during the EatSafe webinars, my name is Bonnie McClafferty. I'm the Director of Food Safety at the Global Alliance for Improved Nutrition and Chief of Party for EatSafe, who is your host for this webinar. EatSafe is a USAID-funded 5-year research and learning program that addresses the intersection of consumers and vendors in traditional markets and their ability to shape the safety of their foods. EatSafe is eager to launch this 5th event in a series of food safety and nutrition webinars. But unlike previous events where we've hosted a very rich discussion on food safety and nutrition related to governance and gaps in knowledge and what food safety actually looks like in traditional markets with a variety of experts, in this one, we will focus on work that GAIN and EatSafe are conducting to keep markets open and operating safely under the COVID-19 pandemic. It's hard to believe that over a year ago, the world was thrown into a global public health crisis that left no one untouched and would test the resilience of food systems. Pandemic projections have painted a dire picture that assert that COVID-19 will wipe out the advances countries have made in reducing hunger and food insecurity over the past decade. For GAIN, COVID-19 has placed a spotlight on the fragility of the food system across the world. GAIN, and EatSafe as part of GAIN, committed itself to recalibrate and add to its existing programs on the ground to help inform and shape how the COVID-19 crisis is affecting traditional markets, where many of the poor and nutritionally vulnerable source their foods. So a bit of a timeline. In February and March of 2020, GAIN responded to the growing crisis and designed the Keeping Food Markets Working, or KFMW program, as GAIN's emergency response to COVID-19. A large part of KMFW focuses on providing rapid support to food system workers, to small and medium enterprises supplying nutritious foods, and to keeping fresh food markets open. EatSafe, with our focus of consumers and vendors in traditional markets, is well positioned within GAIN's country directors and staff to track and provide eyes on the ground to better understand what actually was happening in these locations. In April of 2020, so just about a year ago, USAID contributed immediately to this effort through the existing EatSafe initiative. In May, we began a process of seeking permissions and setting up tracking mechanisms in 2 of the largest retail markets in each of 4 major cities: Dhaka, Abuja, Nairobi, and Addis Ababa. 8 markets in total to track COVID-19's impact. In July through August, we were moving forward to refine and translate our surveys with GAIN's staff in the regions, many times under very strict curfews or lockdowns. We were building trust among market authorities as analytical hands to provide real-time information to support their urgent actions. We were sharpening our tools to rapidly gather consumer and vendor perceptions and record the realities that they were facing every day. We were stocking up on PPE to ensure the highest level of COVID safety protocol for those collecting information and for those who were kind enough to offer their insights. There were teething pains. This is not easy, and I emphasized urgency. Urgently, we were conducting surveys in these densely populated and poorly resourced environments under a pandemic. Urgently, we ensured data collection and our enumerators were safe. Urgently, we made sure that the diverse consumers, vendors, and market authorities understood and welcomed our activities that sought to systematically capture and track immediate perceptions and realities of markets and the actors within them. I emphasize urgently because many of us have been involved in survey and gathering data in what was a less than urgent situation. The urgency put a completely different lens on what was possible, but we will share those results with you soon. Today, we focus on what we saw from September through December of 2020, but data collection continues through December 2021. In this 5th webinar, we will tell you a story and paint a picture that GAIN is seeing in markets. What you will see is not neat and tidy, but given the vagaries of collecting information during a pandemic, it does give us hints, strong hints, as to what is happening and how resilient these markets appear. With the support of USAID, GAIN has been able to collect foundational data to keep food markets working. First, we conduct bi-weekly rapid assessments of vendors and consumers' perceptions and experience in the market. Data collection considers gender and commodities sold when sampling respondents. We also gather prices of nutritious commodities at these same intervals. Secondly, we have established a cohort of 30 vendors and 30 consumers with whom we meet monthly via telephone to ask questions related to market resilience. You will hear from 4 GAIN staff who are looking closely at the data and synthesizing what we are seeing. But behind our staff are many other GAIN staff and partners, including market association leaders who are collecting, cleaning, interpreting, and considering the information for immediate action. A sincere thank you and congratulations to our staff and partners in the field who are working under tremendous strain to inform the global dialogue related to food security in markets under COVID-19. Dr. Nora-Lisa Aberman will present a snapshot of what we've observed from bi-weekly surveys from September to December of last year. The observations reflect consumer and vendor responses from 2 markets each, totaling 2,557 respondents as we last counted, Nora, but you may have newer information. Dr. David Atamawalen is implementing the data collection in Nigeria and interfacing directly with the market authorities who will use the information. David will paint the picture of the market and the challenges we face for gathering this information and transforming it into action in Abuja, Nigeria. Dr. Catherine Demler is leading our cohort survey work on resilience and will present the beginnings, just the baseline of what we're capturing from 30 vendors and 30 consumers related to the strength of the market due to under the COVID-19 shock. Catherine will also give a grounding, just the beginning of what we are seeing as food prices in these markets fluctuate or not. And Rishi Banerjee is the mastermind behind the scenes here at this 5th EatSafe webinar. Rishi will be fielding your questions back to our presenters during the Q&A. Please add them to the chat. We envision this webinar as a series and ask that you on the Zoom join us regularly to track what is happening in these markets as we pull ourselves out of a food security shock. These regular check-ins will allow us all to track changes over time. As I speak, COVID-19 is raging across the globe, with trends by and large heading in a downward, positive direction. Heroic measures are underway to stop the spread and curtail anticipated surges. Vaccine distribution is underway in all countries where we are working. Though there is no one perfect statistic to compare outbreaks, here in the United States, more than 567,000 people have died, mostly in hospitals, and 31.7 million have known to have been infected. In Nigeria, there's a recorded 2,061 known deaths and over 164,000 known infections. Nigeria is seeing a sharp decline in deaths and cases, and David will further elaborate. Bangladesh is currently in hard lockdown with 10,385 known deaths and over 718,000 known infections. On Sunday, a new hospital was thankfully opened in Dhaka with 1,000 beds dedicated to COVID-19. Kenya appears to be falling from the peak of its latest surge with 2,481 known deaths and over 15,000 known illnesses. Nairobi and its environs are under lockdown until May 29th. Ethiopia is no different and is recovering from their most recent surge that has officially added the total, which now stands at over 3,000 officially deceased and 242,000 known illnesses. Through keeping food markets working and with the support of USAID Feed the Future, GAIN has been able to rapidly track what is happening on the ground. We are working closely with market associations and the collection of donors that have thankfully supported the program to provide immediate support based on the evidence collected. And we are looking to the future to help design markets that will make nutritious food safe and available for all. Please place your questions in the chat, and we invite you to future webinars in this series that will give us an even more complete picture of the situation on the ground where markets are working to feed people. I wish you well, and I hope you enjoy this webinar. Lots of great information. Noralisa, over to you.
All right. Hi, everyone. Thanks so much for joining us. As Bonnie mentioned, I'll be presenting today joint work with Grace Hemsfield and Elisabetta Lambertini on vendor and consumer perspectives on the COVID-19 crisis. So I think it was clear going in that these markets have to remain open. These traditional markets are a key source of nutritious food for consumers. They constitute livelihoods for vendors and other supply chain actors. But how do we kind of address the blind spot in terms of understanding the rapidly changing situation? And these rapid assessments undertaken across a set of countries give some sense of vendor and consumer perceptions on market safety, business challenges, consumer behaviors, et cetera, due to the pandemic. So our market surveys were undertaken between September and December, or started in September of 2020, and I'll be presenting the data through to December. I'll present on Bangladesh, Kenya, and Nigeria. Bi-weekly surveys were undertaken with consumers and vendors, and as you can see, they started at different times. So we have 7 rounds in Kenya, 5 in Bangladesh, and 3 in Nigeria that I'll be presenting. Respondents were selected based on gender and commodities sold in terms of vendors. Notably, in terms of the figure here, there were almost no female vendors in Bangladesh and few female customers, in contrast to the situation in Kenya and Nigeria. And so in our analysis, we consider patterns of responses between consumers and vendors across rounds of surveys by gender and by vendor commodity. So starting out, we looked at the share of consumer concerns about shopping in the market. So our consumers worried about going shopping during the pandemic. And we found that of the people we talked to, 70% at the highest, that was in Kenya, to 48% in Bangladesh, did have concerns. Although I'll get into this in a bit, but this level of concern changed over the survey rounds that we conducted. And we didn't find any significant differences by gender in terms of a level of concern or the types of concerns that consumers had. So of those who had concerns, what you can see here is the most common concern, perhaps obviously, is contracting COVID in the market. Next was the sort of challenges of following safety procedures and safety measures. Finding preferred foods, or concern about having the foods that people want in the market, was less of a concern, although for Kenyans, it was 38% of consumers that considered that to be a concern. But not a single consumer in Bangladesh raised this as one of their concerns. So the vast majority of vendors reported taking safety measures to keep themselves, their customers, and their employees safe from risk of infection. So while the share remained over 90% throughout the rounds in Kenya and Bangladesh, you can see this chart goes from September through December of 2020. In Nigeria, it dropped down to around 75%, moving into November and December. Most common measures that vendors reported taking were always to wear a mask. That was 79 to 95% of vendors said that, and reminding people to socially distance. In Kenya only, offering mobile money options was quite common. 36% of vendors used this approach. So when we asked consumers and vendors about safety measures put in place by the market, the measures that were considered most useful were hand washing and sanitization stations, mask mandates for customers and vendors, and this was consistent across countries. Respondents in all 3 countries suggested that market leadership should promote compliance for safety measures and pay for things like masks, water, sanitizer, and put up additional hand washing stations. And they also noted some sense of pandemic fatigue, where compliance with safety measures was decreasing and precautions were more loosely followed. So these quotes can highlight some of the issues that came up for our respondents. The vendor in Bangladesh says, people do not follow the rules now as they used to follow before. The committee should try to convince them about this. And a consumer in Kenya says, hand washing booths should be installed all over the market because the gates are far from the vendors. So asking consumers about any changes in shopping behavior made in response to the pandemic, we see that earlier in the quarter, in September, the majority of consumers are reporting changing their shopping behaviors to decrease their COVID risk. But this decreases over time. We see most strongly in Bangladesh, decreases to 10% of consumers that are changing their behaviors, 34% of Nigerians that are changing their behaviors. Most common in terms of what shoppers were doing or consumers were doing to feel safer shopping in the market was to reduce the frequency of shopping trips and avoid peak shopping hours. And once again, in Kenya, mobile money came up as a common approach. And when asking vendors about the effects of the pandemic on their businesses, they overwhelmingly perceived negative effects, which I think we would expect. So between 90 and 100% overall said they were affected by the pandemic, and only about 2 to 5% perceived some sort of positive effects. The rest were experiencing negative effects from the pandemic. And so, as you can see, this remains consistent across rounds, which is in contrast to consumer shopping behavior changes where they seem to get back to some normal behaviors over time. Now, which business challenges were vendors typically experiencing? So we can see that decreased customers and decreased sales were reported, the most commonly reported effects across all three countries by vendors. And there were no significant differences faced by male and female vendors in terms of the types of challenges they were facing. Difficulty transporting and acquiring products to sell were among the challenges raised by vendors in Kenya and Nigeria, but interestingly, almost barely mentioned in Bangladesh. And now we zoom in a bit here to compare two important challenges faced by vendors: difficulty acquiring products to sell and decreased sales. And we've broken this down by food groups. So, there was a lot of concern about supply chains breaking down due to the pandemic. Here we see difficulty acquiring products to sell was mentioned across all food groups, especially meat, poultry, and fish, less so for grains and legumes in Nigeria and Kenya, but this was barely mentioned in Bangladesh. Only one or two vendors noted any difficulty acquiring products to sell. However, vendors in all countries and for all food groups perceived decrease in sales due to the pandemic. So here we can see, once again, the effect is mentioned slightly more often for meat, poultry, and fish. Overall, in Nigeria, fewer vendors perceived lower sales across all food groups. Besides those small differences, this challenge is relatively consistent across food groups. All right, so summing up, what can we glean from this? What information what can we learn from this? So while it's clear that there are somewhat different challenges and behaviors across these three countries, overall, some interesting shared patterns arose. Awareness and safety measures by vendors and consumers was high, although there was this sense of pandemic fatigue expressed by many. Vendors in Nigeria and Kenya faced supply chain challenges, most notably with meat, poultry, and fish. But acquiring foods to sell was apparently not a problem for vendors in Bangladesh. However, in spite of consumers telling us that they're apparently going back to their normal shopping behaviors, vendors do continue to face decreased sales across all food groups. So this suggests that at this stage of the pandemic, at least, perhaps consumer constraints like affordability might be more pronounced, a more pronounced challenge in the communities that we're working in than these supply chain disruptions. which is important as we consider how we can kind of continue to support and what has to be done to assist markets to continue to work safely. So we'll continue to monitor and assess the situation. This isn't a closed book, right? We'll be collecting the same data until all the way through to December 2021 and track these emerging patterns, see if new patterns arise, adding data from additional countries. And I think also what you'll see Catherine present after me is it helps us tease out the issues that I've raised. She'll delve into a bit more detail on consumer behaviors and vendors' ability to hang in and build back. So thank you so much for your time, and I'll hand back over to Bonnie.
Thanks, Nora-Lisa. Really interesting. And this data across 3 countries will only grow in interest as you said, we're bringing on more countries and of course a longer timeline. So thank you, and thank you for sticking with us, and thank you to Elisabetta Lambertini working with you, and Grace to really clean and go through that data. Really great. So now I would like us to focus a little bit. I'm going to get us to sort of really focus in on one country. And I'm going to turn to Dr. David Atamawalan. Is that right, David? Now you can say McClafferty incorrectly also if you need to, that's fine. But David, thank you for joining us. David is in charge in Nigeria. He is the man that's working to collect all the data to make sure it's synthesized correctly. And I think most importantly, he's actually interacting directly with the market associations who are absorbing this data as it comes out. So David, over to you, thanks.
Thank you very much, Bonnie, and good morning, everyone, and good afternoon. I'm going to provide you a very brief update on the COVID-19 status in Nigeria, as well as a profile of the markets where we work. In Nigeria, we have experienced 2 waves of the COVID-19 pandemic. At its peak, the country recorded about 1,000+ daily new infections. Overall, of the 1,870,915 samples tested, 164,213 cases were positive, while 2,061 deaths were also recorded. In response, the Nigerian government implemented a comprehensive preventive mechanisms, including vaccination. It also signed off an executive order emphasizing the national preventive mechanism, including specific legal sanctions against defaulters. Presently, in the past few weeks, the country has recorded between 26 to 89 daily infections, majorly across 5 of the 37 states of the Federation. Now, looking at the key markets where we work. In Nigeria, we basically work in 2 markets.
David, the presentation is up. I believe Rishi is working it from the back.
Okay. We basically work in 2 markets, and these markets are Goza and Utako markets. The 2 markets are extremely unique and very, very important by virtue of their locations. And in these markets, we sell grains, fruit, vegetable, and poultry products. The uniqueness, again, of this market is based on the volume of trades and their proximity to the primary stakeholders who patronize this market. About 5 states and the Federation also patronize these markets. For Goza, Goza is a transient open market. It is both wholesale and retail markets and operates every Friday. In terms of volume of trades, about 1,500 to 2,500 vendors patronize these markets, with about up to 7,000 vendors also patronizing the market. For Utako market, which is the second market, it is a semi-air market, open air market, well connected to producers and operates daily, but Saturdays is the major day of a trade where you receive a significant number of transactions. It's also boosts of about 4,500 to 6,000 vendors and 10,000 to 12,000 customers. For the market administration, the market is directly managed by the Abuja Municipal Council under the leadership of a market executive officer. Each of the market has a 9-member association made up of council rep and a full type leadership under the leadership of a chairperson. And down the ladder, for the purpose of this project, we also have what we call the market response unit. It is a gender balanced market response unit made up of each of the market has 9, and when you put the two together, we have about 18 that are gender balanced. Now, this organ is extremely important in terms of interfacing with the project, and it reports directly to the market association. In terms of the specific responsibility of this market response unit, COVID-19 response unit, it lies with the project and the ESCO. It also ensures compliance on the COVID-19 prevention in the market, both for the vendors and also for the consumers, just to ensure that people are safe and the market is safe. And the members also disseminate information and create awareness on COVID-19 and what people should do to keep safe and stay healthy. The market response unit also participates in a monthly dissemination of survey reports. So every report, the bulletin that comes up every month, these report bulletins are disseminated to the market response unit. And it is disseminated in such a way that they will understand the information and use the information as a basis for coordinating response, for providing information to their other levels of members, and for them to do what is right. If, for example, they are getting information that indicates that consumers are a little bit more concerned, these informations are provided to their members so that they know what they should do differently. For example, if they are supposed to wear masks constantly and every other actions that will increase the confidence of a market. And lastly, the market response unit also participates in decisions related to market upgrade. So if the project is to implement a specific component of interventions aimed at enhancing market safety, it is the market response unit that will interface and take a final decisions in terms of priorities and what we are supposed to do. In conclusion, I must emphasize that both Goza and Utako market, the two markets of focus, they are extremely important in the sense that these two markets accommodate all strata, all socioeconomic strata. So both the poor, the rich, they're able to go to this market, procure what they want, the food that they want, and take home and be able to feed this family. At this point, I'd like to hand over the baton to my colleague, Catherine.
Thank you very much, David. Let me start. Yes. I have my screen now. Thank you so much, David, for setting this, setting the scene for the Nigeria case. I think that's very rich information, and we're gonna stay directly in Nigeria. So what I'm gonna present to you now is about the Market System Resilience Survey. So first of all, to understand what we mean with market system resilience, I'd like to give you a little bit of a definition by USAID and the framework they came up with regarding market system resilience. So under market system resilience, we understand the capacity of markets to absorb, to adapt, or transform in the face of shocks and stresses. What that means in our case is actually, well, we want to understand how markets are bouncing back. And that's not only about that, but it's also related to the interconnections, to the feedback mechanisms, and ultimately to actually understand dynamics in those markets. And we're doing that, we are assessing this market system resilience to ultimately, well, to improve the market system resilience capacity in the long run. With market system resilience capacity, we don't only mean certain activities or certain aspects in the markets, we actually mean the overall picture. So it's a more systematic approach, and it's about capacity in the long run. The need for that is tracking of different indicators over time. So we started this survey, the resilience survey, in January, and we're gonna track different indicators until December 2021. So it will be a very rich data set. Of course, at this point in time, we're just at the beginning. And I'd also like to highlight that the findings I'm gonna present to you in a bit, they are just the baseline. So we should be careful in interpreting them in terms of resilience aspect. They will become beneficial in terms of resilience over time, but at the moment, it's just a snapshot. So keep that in mind when looking at the data. So what we did is we looked into different types of market system resilience, and we assessed, besides market system resilience as it's defined by USAID, we also additionally assess prices of selected nutritious foods. And we do that for 3 different food groups, namely vegetables, pulses, and animal-sourced foods. And we do that for each of the countries. We do that in a unique way because we really selected those foods according to their nutritive value, but also to their cultural acceptance and accessibility, and, well, whether they are widely consumed by the communities. So we're really assessing prices of foods that are nutritious and that are widely consumed. So therefore, we consider them as very important foods. So we do that, that's actually being done bi-weekly in both of the markets in all of these countries we're working in. And in addition, we assess market system resilience by indicators based on 6 different dimensions of the food market system resilience. And these are 6 dimensions taken from the framework by USAID. They came up with an 8-dimension system. We use 6 dimensions, and they are connectivity between vendors. We also look into diversity of vendors' business setup, but also in terms of products being sold, also in terms of consumer shopping behavior. We also look into equity and fairness, and that's mainly about the difficulty of following new rules under COVID-19 for vendors. We further look into cooperation and competition between vendors, and also include consumers' perception and trust. And ultimately, we also look into business strategies of vendors, and also here we include the consumer perspective regarding feedback. Furthermore, in addition, we also assess aspects related to vendor business challenges and consumer perceptions. So that's how we set up we call it resilience survey. And I'd like to, in the following, give you a short snapshot on what we've been doing in Nigeria. So the data I present is average data, so it's for both markets. And it's for the time, the prices have a bit of a different timeline, but the resilience piece is mainly on observations from January. So starting with the prices. So what you see here are the prices in local currency, that is Nigerian naira, in or per standard unit. So you see the prices are averages for both markets. And you see on the left graph that these are the prices for selected pulses. On the right-hand side, you see prices for selected vegetables in those markets. And what we see here is quite a substantial increase between December and April for the two selected types of pulses. That's an increase between December and April, which is about 40% for both of these types of pulses. We also see on, well, contrary side for vegetables that we have a slight increase actually if you compare prices between December and April 2021 for the different types of vegetables. We also see that there's a bit of fluctuation, particularly with tomatoes. Looking further into animal sourced foods, we see that also here overall, and we look into eggs, beef, and chicken and fish, we see that here also we can observe a slight increase over time between December and the assessments in April for some of the foods. We see even an increase of around 30% for beef, which is the very pink on top here. But we also see that there is actually no change overall in the assessments for chicken. So these are, as I just said, it's just a snapshot at the moment. I mean, it's just 4 months that we're in now. Of course, the benefits of the overall resilience assessment and the prices, they will be much stronger over time. So tracking those indicators over time, tracking prices over time is substantial to actually make any conclusions in terms of dynamics and resilience in the long run. So this on prices. Going further on our resilience survey. So we asked consumers about their financial impact. And as you've already seen in the rapid assessment that Nora presented to you, we also see here that we have COVID-19 affecting consumers and their households. So 88% of our panel of consumers state that they were financially affected by COVID-19. What we see here in this now a bit deeper dive into these consumers panel, we see that over a third mentioned that this was due to a loss of income source, also due to reduced income. And we also have consumers stating that it was due to an increased cost of basics. And with basic, we also include foods, but transportation costs as well, and also services. We also see that few of them mentioned that there has been a decreased access to credit or illness or death of an income earner in the households. Furthermore, on consumers, we see that 63% of consumers made changes to the food they typically bought during COVID-19. And that's particularly interesting, of course, in the long run, as this might also affect diets and ultimately nutrition of consumers. What we see here is that out of the 63% of consumers that stated to make changes, we have the majority of consumers stating to have decreased quantity of some foods. If we dive deeper into this, we see that the majority of those that made decrease or that stated to have decreased some foods, that they have actually switched in certain types of food. We see a switch from more highly priced rice to more local varieties. We also see that the reasons for the decrease in quantity of some foods were mainly about prices. So changes in prices were mentioned by over 70% of those that mentioned that they had a decrease in the quantity of some foods. Looking into vendors, and here this is about cooperation, the dimension of cooperation. And it's interesting to see here because we asked the vendors whether they started sharing resources in times of COVID-19 to actually increase their sales. And we have over 2/3 of vendors who mentioned, we have actually 1/3 of vendors stating that they started sharing resources during COVID-19. And the type of sources they started sharing majorly about sanitizers, but also masks, suppliers, hand washing facilities, and even some mentioned storage rooms. So it's not only purely about COVID-19 related resources, but it's also about other resources regarding suppliers or storage rooms. So more, well, general resources, I would say. What we see further regarding vendors is that, and that's also following up on what Nora already mentioned, also here we see over half of the vendors have borrowed money due to COVID-19 to actually cover unexpected costs or an increase in costs. So what is particularly interesting, I think, is to highlight here that the source for the borrowed money came through, and this might not be the surprising part, majority stated that it came through relatives and friends. But interesting to see is that we also have 19% of those that borrowed money stating that it came through other businesses. And we also have 13% of those saying that it came through banks, 6% also mentioning informal cooperatives. So that kind of implies that that some of the vendors at least have access to formal structures, to credits. And of course, this needs to be analyzed over time and needs to be seen whether there is more vendors having access to credits, or what are hindering facts, or what are enablers for that. We also staying with the vendors in terms of business strategy. We also asked vendors whether they have taken on additional business strategies to manage the difficulties and to start additional advertising or similar to increase their sales during COVID-19. And we have over a third of vendors, or actually a third of vendors, that have taken on business strategies. And out of those, we mainly see that they provide discount, additional services, credits, used advertisement, asked their own network to go shopping. But what I think this shows is that there is some strategies in place, and their vendors know how to fight back or to actually build back in terms of crisis. Overall, I'd like to conclude that what we are seeing under this very first results of the market system resilience, the tracking exercise, we see so far that consumers and vendors are being affected by COVID-19. There is financial impact, there's business impact, but we also see that certain mechanisms, resilience mechanisms, are actually in place. And we need to track them over time to understand the dynamics of these, and to actually, ultimately to build further capacity. And that in the long run. So yeah, what's actually next? Well, please stay tuned. I mean, we are on that. As we are talking, we're assessing prices. There is the monthly tracking of market system resilience, and the price tracking is actually ongoing. So we started in January, and this will continue in 10 markets in the countries we're working on until December 2021. And we also analyze and summarize these findings by municipality. Here, the example on Nigeria, that was all on Abuja. But as Bonnie mentioned, we also work in Dhaka and in Nairobi and in other cities where we produce these monthly traditional market reports. And these are shared directly with the market associations, with the cities, with subnational officials and other stakeholders. So our findings are directly disseminated. Last but not least, and I think very important, I'd like to thank all our fantastic teams who are doing a fabulous job out there. That's not only David and his team, but these are also the other teams in Kenya, and that's the teams in Ethiopia, in Tanzania, and in Bangladesh. And I think without you, this wouldn't be possible. And I'd like to thank you. I think your work is extremely appreciated. And with that, I'd like to give it back to Bonnie. Thanks.
Well, thank you, Catherine. Thanks everyone. And Catherine, really interesting. And David, there's a couple things that I find that we will dig into the future based on what you're seeing. I think the price question is really interesting. I note that what we really needed to do on top of this is, as one of the participants has mentioned, is, how are these prices actually seen by consumers? And I would add to that, it would be interesting to see what were those prices a year ago, because, obviously seasonality is something that we have to take into account also, but it's a great way to start, again, just the beginning of a really rich set of data on nutritious foods in particular. David, what's so remarkable to me is how this project has been embraced by the market governance structures. Clearly, they were in need of information, and and I have to say, I can say across all countries where we're doing this work, we are working hand in hand with those market authorities. And I hadn't realized, David, that the market response units, which we set up actually to help us communicate and channel the information back into the market authorities, actually have turned the market response units into a really strong support structure for those authorities as well. So that's very encouraging. So everyone, that's what you've seen for September to December, and then the latest information on resilience. Again, we will be having another round and another collection of information to share with you. So this opens the session up to our question and answers. I saw several coming through. Again, what we were trying to do is just track. We were tracking information. Going forward, though, however, we are, as a team, stepping back and looking again at our surveys. The surveys are a constantly kind of living document, in that in each country, interpretation needs to be quite clear across all, but also there are additional questions we want to be asking. We want to be asking about the processed food question, and how are people turning to more processed foods, shelf-stable foods. From minimally to ultra processed, what does that continuum look like in these markets? So with that, I'm going to turn it over to Rishi, who has been collecting your questions both through the Q&A and the chat. Rishi, feel free to send them on over to who you think can answer them. Thank you.
Great, thanks, Bonnie. And certainly, just with the questions that have come in so far, there's just great appreciation for these markets around the world and how important they are for their communities. We have a question about, I think this is probably directed towards Catherine, but regarding some of the price increases and decreases that we've seen. Do we have information on how significant they might be for particular households, or is that data that we might be getting at some point?
Thanks, Rishi, and I appreciate the question, Lourdes. I saw it on the chat. At the moment, we're just tracking those data that are coming in for prices. But we have not yet combined it with with what we are seeing with consumers. So we can't at the moment combine and see whether this particular price increase has been or has led to a significant change in consumers, if I understand your question correctly. Because of course we can see type of changes we have over time and whether they are significant. But I assume you're asking directly in regard to consumers. So at the moment we have not analyzed that yet, and but it might be something to look into further.
Great, thank you. So our next question is about, again, kind of the impact of COVID and the diets and the food that's being purchased. So this is, I guess, kind of maybe broadly to the panel, and whoever would like to can chime in. But have we seen a shift in quality of diet and food purchases? It might be expected that a decline in dietary diversity in favor of maybe cheaper and high calorie foods could be seen, as a result of some of the loss of income and the affordability of high quality diets. Anyone want to take that?
Sure, I can jump in on that. I think that the question came during my presentation, but it isn't something that my presentation really speaks to, although we can see these patterns and well, vendors are selling, you know, less food. It doesn't tell us why, and it doesn't tell us, we see it's pretty consistent across food groups, at least for this, you know, snapshot of data. I think comparing it to pre-pandemic, we don't have that data, but one of the things in the resilience surveys that I think is yet to be analyzed is asking consumers, by specific food, are you purchasing less of this and why? And so once we have more data on that, we'll be able to see over time, how are people comparing what they're purchasing now to previously, and we can parse it by different food types. So get some sort of plausible sense of how diets are shifting without having that specific dietary data. Although we do have in the KFMW program some other assessments going on that might get at that question a little better.
Great, thank you. And Nora, I think this one might be going back to you, but you know, just regarding existing infrastructure, like hand washing stations, access to water, drainage, is that something that we've seen for, is pretty common? Is that something that's relatively new? And where they are already in place, you know, are there any connections to, you know, reducing COVID spread in those markets? Do we have any data on that?
Well, so what I can say is that one component of this work was a set of infrastructure audits across all the markets where we're collecting data. You know, if we say, well, do we see a connection to reduce spread? Obviously, we're not collecting data as that sort of health data, but what we do know is that vendors and consumers consistently say that hand washing stations are critical. They consider them super important for reducing spread and reducing risk. And as to what this kind of status is, I mean, I can just say overall, we do have a report on that we can share with the details, but overall, a lot of the infrastructure is there, but it's maybe in disrepair, or, you know, even if there is a water tap, the water supply is unreliable. And so it's really about upgrading and improving a lot of this infrastructure.
Great. So we have another question here, and so for our attendees, please continue to send in your questions. These were really great, and we will definitely get to them. So we have another question here, I guess kind of how this project has been set up and the planning phase of it. So what, I guess, geographic considerations were there as I guess markets were identified, you know, and the data collection plans were put in place? You know, and I guess this question is related to you know, kind of data uniformity, or ensuring that we're maybe representing different geographic regions. Is there anyone that's able to speak to that?
Well, I can start. When we designed this, and again, we were going in under a pandemic, we designed this so that there was very little movement, and we did not want to put too much of a burden or exposure to our teams to be traveling, and the travel restrictions were pretty much curtailed a lot of movement. So we ended up working in these very large cities, which were in close proximity to the GAIN offices. Again, it was very unreliable whether we would be able to go anywhere, and we had to work with what was nearby. That said, I think it's a really great question. As you know, the influence of these markets on food security and food safety remains paramount, whether the pandemic is happening or not. And in fact, we need more data. We need more data on the safety of these markets, the food safety, the hygiene, the quality of the foods that are in these markets. And so going forward, that is a very good suggestion on how we would go about ensuring that we have a more diverse data set and that the analysis itself was more representative at a national level. That, of course, would feed into a dialogue with national systems, but we would also be able to get that at a state level or even a municipal level to help in the planning and building markets so that they're safe and accessible to all income groups. So that's a start. I don't know if anyone would like to comment on the actual, any other questions related to what came through.
Yeah, maybe just to add, if I may, we also choose the markets, or just to add on what Bonnie said, we also choose the market to have a variety of, we clearly wanted to have retail and wholesale in this market, or definitely we wanted to have retail and we wanted to have consumers. So because we wanted to see how are they being affected. And we also wanted to have markets that are actually selling a variety of foods. So we did not only look or go into those markets that say majorly grains or other staple foods. So we really wanted to see those markets, those informal markets being affected that are selling that we consider nutritious food. So what is happening in those markets where people get their fresh fruits and vegetables? And that, of course, has some limitations. And then, as Bonnie said, due to the pandemic that was ongoing, we had to make certain considerations. And of course, in the long run, that would be very beneficial, expanding that work. But but these are some other considerations we had to take. Also in regard to where we had existing relations with the market associations. I mean, we built that up from scratch, and actually just rocking up at the market and saying we'd like to interview your vendors and consumers during a pandemic is not it's not an easy task, say like that. And I mean, David, I'm sure you can contribute to that this is that was an extremely intensive process, and therefore we relied on existing structures that we had, and therefore made our sample based on these markets.
Yeah, David, is there anything you'd like to add? I think you might be able to add some color to this conversation here.
Yeah, I think Catherine, she's extremely right there, because just going into the market and trying to generate some of these information and get people to actually participate was not just an easy task, but based on the kind of relationship that the project was able to build and nurture over time, it became a lot easier, because a huge partnership has been established between the project and the market response unit, as well as the other key stakeholders. So if we're going into the market response unit, they are aware of the next level of activities that we want to do, and because they are carried along with sort of strengthening ownership. So you see that things are a little bit easier. There's a lot of confidence. There is no suspicion in terms of the objective of the information that will eventually be generated. So that has a lot made it a lot easier. And the other part I also want to contribute is a question that was asked earlier regarding the market infrastructure audit. In Abuja, in both Utako and Goza, we did carry out a very comprehensive market infrastructural audit. And in the past, when you want to do something like this, people don't attach a lot of importance. But because of the level of awareness that has been created, but because of the significance of COVID-19, the market response unit, they were with the contractor that actually did this work. And they follow through the entire process and able to prioritize their needs in Goza, we're able to understand through the market response unit that water is extremely important to them. So you need to provide a borehole. And they also made it very clear that, well, toilet facility is also a very big deal for them. And we're able to connect that with the market, municipal council, who are willing to join hands with the market response unit in actually supervising the implementation of this market upgrades that is going on and supported, by the project as a collective response to market safety and the prevention of COVID-19. Thank you.
Excellent. Thank you so much. So we've got our next question here. I think is really interesting, and it's about whether we've seen or whether we've heard or seen anything from vendors and consumers about how they view food safety in markets as a result of COVID-19. And certainly I think there's some connections there, but yeah, who would like to jump in on this one?
Yeah, I think let me give it the first shot. Again, because of our working with in the various market, both Goza and Utako, the coming of COVID-19 have sort of raised the bar in terms of the capacity and the desire of consumers to be a little bit more, cautious in terms of what they buy. People when they go to the market, they want to see who is that vendor that reduces their risk. You see people looking at and seeing, they want to patronize a vendor, for example, that is putting on a mask, because they believe that, okay, if we are coming to you and you're putting on a mask, it means that you are conscious of COVID-19, and it means that we're a little bit more safer. And that is why when you're going into the market and maybe you see a vendor that initially is not maybe wearing his or her mask very well, you see them, they are adjusting their masks just to give the consumers some bit of confidence that, look, I got your back, and I'm aware that COVID-19 is a big issue. And again, I am also, playing my role in keeping, everybody safe. And in terms of, food safety also, I think it's also strike in the heart, of food safety and again to the household, because when people are conscious of their health, the understanding is that plays also a big role in how they handle the food stuff that they sell to people. So it's all connected. So your ability to demonstrate that, look, I take COVID-19 seriously, I take health seriously, translate to how you manage your food. And when I buy my food stuff from you, I'm a little bit safer, because even when I'm not there, I can guarantee that you take health very, very seriously. That's the kind of message we are getting from the markets.
Rishi, maybe I can add to that question.
Please.
Thanks, David. So anecdotally, we're hearing that, for example, in Bangladesh, that vendors have actually looked back into the supply chain for certain safe attributes of food from their suppliers because of the safety issue that David's talking about. The consumer, the customer, is becoming more aware of the safety of their foods and requiring that of the vendors that they're choosing. So anecdotally, we're hearing this. It hasn't been tested, but we certainly do have a question in the survey about whether folks are worried about their safety of their food. I believe maybe somebody on the call can answer that, and if not, maybe we can just save it for the next grouping. But one more thing I think that's worth noting is when we have these conversations about food safety, nutrition, COVID-19, we're finding that actually it becomes this new approach. It's not new for some of us, but the approach of taking a food systems approach is critical when you get into these markets at this level, looking at COVID-19. All of a sudden we realized when sanitation shuts down because of transportation or because of lockdown, it introduces a huge vector into the food system and into foods that are being purchased by lower income consumers or folks who use these markets. So it's not just the food system we need to worry about with the ultimate health outcome of populations. It's also the interconnected drivers and the interconnected systems that in the time of a pandemic shuts down all of the other hazards and dangers that come with keeping food safe and available. So we definitely have found that when sanitation systems shut down, we have to be worried about food safety. We definitely find that when transportation shuts down, we also have to be worried about the safety of the foods. So the flags are going off. We have yet to measure them. Thank you.
Great. So I've got another question here, I guess just going back to the markets and how they're adapting and changing. Do our panelists think that that these markets might change for good, and change maybe permanently in terms of evolving into more markets that are smaller? Maybe I know many markets have adopted more structured hours. Do we think that those kinds of changes might remain even after we are through with the pandemic? Or is there a reluctance to some of these changes?
Okay, let me give that another go. I think for Nigeria, what we are seeing right now is a change in consumer behavior. We're beginning to see that because of that change, it is also influencing the trading pattern and strategies of the vendors. A lot of vendors and consumers are going into online trading. So you will see that people are beginning to monitor the market and they are pulling back during peak period. People don't want to go to the market during peak period. They're trying to, analyze the volume and know when should I go to the market. Is it going to be in the morning? Is it going to be in the evening? Or is it going to be in the afternoon? Because it reflects, their risk management pattern. So in a nutshell, it is difficult for us to say whether these changes will be sustained or they are going to be with us for a very long time. But one thing that I'm so sure about is the online trading. I believe that it is growing, and we are even conducting some trainings for SMEs on digital trading, because that is where a lot of energy, a lot of effort is going into right now. Online trading, it will continue to grow, and we'll just see how the momentum continue to move. Thank you.
Yes, and David, to add to that, mobile money is becoming far more frequented in these markets than it was. The other thing that I think we're seeing is that governments are responding pretty quickly. And so these market audits have been essential because they're feeding information onto what might be a best, smarter market. And there have been some countries that have decided to actually build new markets because of COVID-19. This work is also taking place in Ethiopia. A brand new market got up and running. And so these considerations actually have been part of that architecture. So yeah, I think that there are some changes, but how sustainable they are is the question.
I also quickly add on that, just to share some experiences that we see in Kenya. And I think that's super intriguing, because there we have, in one of the markets, we saw that the vendors that were pre-COVID in the markets, that there was actually a substantial decrease in the number of vendors during COVID-19. So that because there was no business anymore, or they feel there was no business, and they were leaving actually the town to go somewhere else and find business elsewhere. Also in Kenya, in the other market we're working in, we see quite the opposite. We see that the market had a substantial increase in vendors. So there were other people in the informal sector who tried to make businesses in the market. And so those markets were even more crowded than usually, and more vendors came in there to, well, to try to make their living, to make some money. And I think actually first of all, I just wanted to share these insights from the markets, and particularly underline that it's also, even in the same countries, in the similar locations, we see very different dynamics. And that, I mean, that really speaks for the tracking we are doing, to really look into what's going on and to see dynamics over time. So there is, there is definitely differences between different locations, and that also needs to be taken into account. Thanks.
Yeah, that's really helpful, and certainly I think that evolution, yeah, will just continue, and e-commerce has played a big role, you know, in so many different ways, and a global pandemic certainly is one of those contributing factors for the growth of e-commerce that we've seen recently. Sorry, go ahead. Yeah.
Yeah, so Rishi, I see that you're asking, and to you all panelists, shall we wrap up? And we are here. We are here to answer questions if you'd like. But maybe what I'll do is, for those who want to, you know, rotate off, please do. But before we do, I want to thank all the presenters. Good job in weaving this all together. It's such exciting news, and it's quite frankly exhausting with the teams in the field, but they're doing incredible jobs. Please, everyone, stay well and stay safe. And I think that one of the things that we should know, the audience should know, is that there are products right now available to look at this data a little closer. We have on the GAIN website, as well as on AgriLinks, for those who are members of AgriLinks, we have all of the bulletins. So when this data is gathered every 2 weeks across 5 countries, it's submitted to the missions, but it's also put into bulletins that you all can read online. And they're very rough and ready, but they do present a lot of the findings. In addition, Catherine is authoring what we're calling traditional market reports, which are reports that go to the municipalities primarily as the audience, but they are very rich and present in the presentation of the resilient information. Those also are available on the GAIN websites, as well as on the AgriLinks website, so via AgriLinks. So I'm gonna just call this as an end to the webinar. We will be hosting another, but please, we are all here to stay online and answer additional questions if you'd like, maybe for another 10 minutes. Thanks.
Great, thanks everyone.